Every time you buy new technology or implementing a new system, you are on the gray zone, meaning that sensation that is not natural, that is not flowing, that you're wasting time and energy, and that's normal, but you need to insist. Repeat, 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 and if the system is good, routine will kick in, and that's when you're going to start making money with it. People that are making more money because of PIC, they did the two things. First, they learn the big picture, and then to have the strength, the resilience, the discipline to make this become a routine, insisting, repeating over and over again, not doing it in a different way on the first difficulty.
We used to say the PIC system provides the accuracy, but the PIC Pro training provides the predictability. When you combine predictability and accuracy, ends up in a scale of the productivity. So predictability and accuracy, it's more productive. During 2 months, 3 months, 4 months, growing your productivity, you end up in a consistent workflow. And this consistent workflow, of course, you can have small moves, and this dynamic and flexibility is needed because more technology is going to come, and you have to be able to implement this technology easy. You don't need an extra course, because during this course you see like the matrix. It's not you with a recipe. We are not providing recipes.
That is the real system, is the whole process. And when you hear, you need to start with the why, right? It sounds obvious, it sounds cliche, but that's what we need to ask when we buy a technology. And many people say, why do I want PIC? Oh, because I want to scan with more precision. That's the obvious answer, but it's the wrong answer, because that's not the why. The why is the final smile. That is the smile rehabilitation, the full mouth implant rehabilitation. So you need to go back, understand the whole process from first appointment, data collection, facial analysis, digital smile design, then you go into treatment planning, then you go into surgical planning, then you go into surgical execution, then you understand the right moment to actually scan your implants, what your lab needs to know, what softwares need to be used, how do you export, import the files.
A very common situation that we face during the courses with our customers is they already know how to plan, they already know how to execute, they are super surgeons, they are great doctors. They are used to go with their surgical mind, to go there, do the incision, open the flap, and then start placing implants, remove bone. But then we stop them and say, wait, we have to plan. Before you do that, we have to plan which natural landmarks or which implant landmarks are we going to keep or remove from the mouth in order to have references after and before for the digital workflow.
To overlap and combine.
To overlap, combine the files. At first, they are like, what are you telling to me? Look, now, because you are in the surgery, you just follow my steps. Then we will stop, we will go to the software, and I will teach you what would happen if you didn't do that. And then we simulate, teaching him, look, overlapping the files with landmarks, without landmarks. So they say, oh, so I have to do a 5 minutes longer surgery to avoid 5 hours of prosthetic remakings. So if just giving 5 extra minutes during the surgery, you avoid 5 hours of remaking and remaking and remaking 4 months.
And that's the shift between the analog mindset into the digital mindset. Because in the analog world, there's no way you can copy-paste the project. So every step, you're starting from scratch. The digital world comes to solve these problems, but then you need to change the way you think. You need to change the mindset, and that's what we call copy-paste dentistry, meaning that you started from a digital patient, you developed a project in the digital environment, you're executing something in the mouth, and you want this project to be exactly the same after your procedure. It's like an engineer, it's a blueprint, and the final construction. And to be able to make this happen, you need to overlap files on the software. And to overlap files, you need to have landmarks to allow the software to overlap these files. So it's a beautiful challenge for the doctors that are embracing this new mindset, because as soon as this becomes your new routine, your life is so much better and you work with so much less stress.
It's not only beautiful and stressless, it is productivity. Yeah. Because these 5 minutes in the surgical procedure, you can only get the advantage of this if you become a digital dentist. Yes. I'm sorry, but you will not be never as productive as digital workflow.
In between, yeah. That's what I call the gray zone. The doctor says, I'm a digital dentist. Why? Oh, because I do some guided surgery cases. I say, look, that means nothing. Actually, the word some already tells me that you're not, because it means that sometimes you scan, sometimes you don't scan. Sometimes you try to think digitally, sometimes you don't. And that is not productive. That is not efficient. When you embrace it full power, that's when you get the money back. I don't know one dentist that went full power digital past the gray zone, meaning digital became the only way and became a routine, and then said, no, I think I'm gonna go back, it's better. That story doesn't exist. And that should mean a lot to all the doctors that are, should I do this or not? I don't know one that regret that journey. So that should be enough for people to understand where do you get more efficiency, where do you work with less stress.
But they have to pass the gray zone.
They have to pass the gray. That's like humans are. We don't like to change. We don't like to move into the new. So we need to have the strength and the discipline, and that usually comes from the clear vision of the benefits that this new system will bring to us.
We used to tell to the customers, they ask, oh, how much is the system? How much is the training? Well, the training is very expensive, and together with the system is the most expensive technology in the clinic. And I used to say, you know what is even more expensive? Stopping your clinic for 1 week, because you are going to sign that you are not taking urgencies, you are not attending other patients, but my course. So this is expensive. Yeah. Stopping your business for 1 week, this is very expensive, but it's true. You want your associates, your auxiliaries, your technicians, and yourself to be
immersed.
Yeah. You need to stop. You need to be focused on this new digital workflow.
If you really want to change, that's the shortcut. Yeah. That's the shortcut.